Welcome back to Always Something. I just got done with my follow-up visit for my surgery. I had so much anxiety going into this appointment. I originally wasn't going to have a follow-up visit, but they put me on an as-needed basis, and this was needed. It was needed because I was still having pain from my surgery. So I went back in and I talked to the doctor to figure out why I was still having pain. Now, it was my understanding that you would heal from this surgery in about a week, and then the week became 2 weeks, and now I'm 6 weeks in past my surgery. So in today's visit, I learned that because of my autoimmune condition, that it can take much longer to heal.
How are you? Nice gloves.
Thank you.
Do you have a runny nose or no?
Yeah.
So those help.
Yeah.
You were wearing gloves before, weren't you?
Yeah.
Really?
Yeah.
So your breast is hurting you?
Yes. It's never stopped hurting me since the surgery.
Really?
And my last stitches just came out on the 22nd.
What do you mean by last stitches?
How the stitches were coming out.
What?
You know how you put the stitches in and you said they'd come out?
No, they just dissolve. Most people never see stitches. Stitches actually came out?
Mm-hmm.
That's unusual.
Yeah.
Atypical.
Oh.
See?
I mean, they're all gone now.
I believe you.
So, yeah, because it was how it was all around there, and they were slowly peeling out the whole time.
Well, that was the glue.
Okay, well, the last.
Yeah, the glue was on there. That wasn't stitches. Stitches are all under the skin.
Okay.
Yeah. So fibroadenomas are almost never painful when they have that again. So I can see them here.
But I haven't been able to. I haven't been able to lay on my chest since it's happened. I haven't been able to bounce around. I haven't been able to put pressure on it. I've been having pulsating pain, sharp pains.
Well, that is entire. So everything that you described to me initially about the glue coming off and about there being bruising is 100% normal.
Yeah.
And it's that way with every breast surgery we do.
And then I had my infusion on.
But having any discomfort in the breast at all after surgery is 100% abnormal. I never see it, never hear of it, have no idea what's causing any of that. It looks normal.
Yeah, it does look good.
I fear that this has something to do with whatever's autoimmune going on with you. Because there's nothing, meaning that anything that looks and for all functional purposes is normal, that there's nothing really to do about it. I suspect that perhaps you just have a slower healing than most or than average because of the autoimmune disease. And it's just going to take you longer for everything to normalize. You know, like every surgery, not so much this one, but almost all surgeries have a period of time during which pain is normal. Every surgery has some pain, and then after just a brief period of time, it gets much better, and then with time there's zero pain. I suspect that my best guess is that it's just taking you longer to get to the point that you'll have zero pain. Because you will. When it looks like that, then there's clearly no fluid collection, there's no infection, there's no mass that I can feel. The incision's nicely healed. Everything is as good as I can do. I suspect it's just diffuse inflammatory change. My job is to make sure that there's nothing going on surgically that I should or could fix or do something about, and there's not. Okay. So I'm glad you came back in because I can reassure you that everything looks as normal and as good as it can look. And I think that with time this will all go away. That as the tissue is all now, it takes for complete healing after a surgery, even though everything looks pretty good, it takes really 3 to 6 months before things stop changing inside.
Okay. And
just with you and the medication you're on, because everything that affects your immune system affects your inflammatory system, the inflammation, the healing of all this, and I think that it's probably just delayed related to that. Okay. There's no other reason I can think of why getting an infusion would make that uncomfortable. It just sort of doesn't make sense. I believe you entirely.
Yeah.
I just think that I'm reassured by how it looks and feels.
All right.
Yeah. So I did your surgery on
the 15th.
December the 15th.
Yeah.
We are February the 1st right now, so it's been about 6 weeks. So if I had to bet and put money on it, I would guess that within another 6 weeks, when you're 3 months out, that you'll have no symptoms or discomfort, that everything feels like your other breast doesn't bother you, right?
No.
It'll feel like the other breast in 6 weeks is my guess.
All right. So just
Now
hang in there.
with Jane Average, when I see them back a week out from surgery, average person has almost close to no discomfort, and if I see them at any point thereafter, they have no discomfort. You'll get there.
Okay.
Because it looks fine. Okay?
So the lesson from today's visit is patience. Patience is hard on everybody, but it's especially hard when you're in pain. Looks like I'm gonna have to wait a little bit longer for the pain to go away, but at least I don't have to go back into surgery. So there is always something to be happy about. You just sometimes have to look a little bit harder to find what it is. If you're like me and you're struggling with a pain issue, then know that you're not alone. My heart goes out to anybody dealing with any kind of pain issue. It can be tough. If you'd like to see more videos like this, please remember to like and subscribe to my channel. Thank you for watching.